Well done, Vernon, to kick us off there. And I must acknowledge the support of the Poultry Meat Award Syndicate, Avigin, Cobb Europe and Hubbards, who supported Werner in his scholarship. And now we move on to Sophie Edenborough from South Shropshire, not originally from a farming background, but working in agriculture since graduation. Experience in both dairy and poultry sectors, currently Poultry Director at Liquid Mineral Services. And Sophie is kindly sponsored by the Three Counties Agricultural Society. So, with the topic, No Antibiotics Ever, an option for the UK poultry industry, I give you Sophie Edenborough.
Good morning, ladies and gentlemen. It is with great pleasure that I stand before you this morning. I'm Sophie Edenborough, and today I'm going to address the question, No Antibiotics Ever, an option for the UK broiler industry. Before I start, I would like to take this opportunity to thank both the Nuffield Farming Scholarships Trust and the Three Counties Agricultural Society for giving me this opportunity. I'm especially grateful to the Three Counties for their very kind and generous sponsorship. I would also like to thank all the people who've helped me out along the way. There's a very long list of you, and you all know who you are. At the commencement of my study, it was rare for a week to go by without the media publishing articles about antibiotic resistance, often linking them to the agricultural industry, and citing the use of antibiotics in agriculture as a key contributor to the development of antibiotic resistance in human medicine. During my study, it became quite clear that it is actually very difficult to quantify exactly how much effect the use of antibiotics in agriculture has on the development of resistance in human medicine. But the necessity to preserve what antibiotics we have in agriculture still remained. There is a need to ensure that we slow the rate of development of antibiotic resistance in agriculture, irrespective of any links to human medicine. And with the ever-present threat of a change to the legislation surrounding the use of antibiotics in agriculture, specifically within the UK broiler industry, I was driven to try to find some solutions that would be of use to UK poultry farmers, should any legislative changes come about. I particularly wanted to assess what products and practices were being applied on the broiler farm that might enable UK poultry farmers to think about reducing their antibiotic usage. And during my study tour, I also developed an interest in the key factors that drive a company or poultry producer to change the way in which they use antibiotics, and what effect those different drivers for change can have. No Nuffield presentation is complete without providing you with the itinerary of my study tour. The Dutch agricultural industry has been under immense pressure from its government over the last few years to reduce its antibiotic usage, and I wanted to speak to poultry farmers and vets to find out how they had adapted and reacted to the changes. Brazil was my second trip, in order to ascertain how poultry was raised without the level of consumer pressure that we experience here in Europe, but also to visit with companies that were looking to export their produce to Europe, which means that they cannot use antibiotics as growth promoters as they can for birds for the domestic market. And finally, I visited the US, with particular interest in companies that were producing poultry with no antibiotics at all. In US supermarkets, you can purchase poultry meat that has been marketed as having had no antibiotics ever. So I wanted to meet with the growers producing this meat to find out how they do it. During my travels, it became quite clear to me that there are a number of key areas that poultry farmers need to consider when thinking about reducing their antibiotic usage. And for the purpose of this presentation, I'm just going to focus on a couple of those areas. So I'm going to start with alternatives to antibiotics. I found this a really interesting area to cover when looking at ways in which we can reduce antibiotic usage. When I spoke to a number of people, I asked them to rank factors as to what they thought were the most important things to consider. Was it biosecurity? Was it having a good farm manager? Was it changing the attitudes of people towards antibiotics? And the use of alternative products always ranked really low. Poultry farmers didn't think that alternatives to antibiotics were particularly important when it came to reducing their usage. But then when you ask these farmers, are they using anything that would be classified as an alternative, Nearly all of them are using at least one, if not more. The second thing about alternatives came from a visit I paid to the International Production and Processing Expo in Atlanta. Prior to the main event, they hold a scientific conference where researchers, companies and universities present papers on their latest work. So I attended a number of presentations about probiotics, organic acids and essential oils. And it became quite clear to me that the poultry industry still does not fully understand how to get the best out of these products. Whether it's which organic acid do we use, which strain of bacteria is best in a probiotic, or when do we apply the products to get the best out of them. It seems that we still have a lot to learn, and there is huge potential for these products to aid in reducing antibiotic usage in the future. For those of you in the room who know what I do as my day job, you may think I've included this for business promotion. However, even I was surprised by how much attention is being paid to water quality by producers around the world. The importance of good quality water and water hygiene management is something that is often overlooked. However, nearly all of the people I spoke to as part of this scholarship cited water as one of their key areas for improvement when reducing their antibiotic usage. Whether this is improving their terminal hygiene programs, paying more attention to understanding the incoming supply, or investing in systems that provide continual sanitation, there was a definitive move towards ensuring that birds are receiving good, clean, quality water. There are a number of companies, predominantly in Holland, that were developing systems that enabled chicks to have early access to feed and water. In the current hatching system, the chicks will hatch within a time window, and all the chicks will remain in the hatcher until that time window is complete, after which they are then sorted and transported to farm. In extreme circumstances, it can be up to 72 hours before those first chicks that hatched have their first food and water. And research has shown that chicks provided with feed and water immediately post-hatch have accelerated gastrointestinal tract development and immune system development, and therefore they're more resistant to disease challenges later in life. So the first system I saw was the HatchTech Hatch Care system. This is a hatching unit based on a two-tray concept. The eggs are placed in the top tray, and when they're hatched, the chicks drop down into the tray below, where they have access to feed on two sides of the tray and fresh running water on the other two sides. The second system I saw was the NSch system, which was developed by a company called Antibiotics. The system consists of a metal framework that is installed in the broiler house and can be winched up and down as and when required. The broiler farmer will then receive 18-day incubated eggs, and the remaining 3 days of the hatching process will be carried out in the broiler house. Before the eggs arrive, the house is heated to 36 to 37 degrees Celsius, and once the eggs arrive, their temperature is monitored regularly using a human ear thermometer. I visited a trial farm in Holland where the farmer had had the system in use for 8 flocks. He reported an increased weight of 50 to 60 grams and an FCR improvement of 3 points when comparing the extract house to his control house. He also felt that the system was helping him reduce his antibiotic usage. The third system is the patio system, also developed by Antibiotics. It's based on the same concept as the extract, with the final part of the hatching process being carried out in the broiler house. However, in this case, the broiler house is actually a multi-tiered unit with 2 rows of 6 tiers. The system is highly automated, providing a high level of biosecurity, and uses 3 times less floor space than a traditional house. The test farm I visited had been running since 2008, and they'd run 66 cycles of birds through without using any antibiotics at all. So you can see from just the few areas I've talked about that there are a large number of options available to UK poultry farmers that might assist them in reducing their antibiotic usage. If a poultry producer is going to start to think about reducing antibiotic usage, there are a number of things that they need to consider. And the first of these, as with any business, is cost. I found quite mixed opinions around the world as to whether removing antibiotics from poultry production comes with an increased cost. One view is that if you have the correct programs in place, you receive good quality chicks, you pay close attention to your gut health and replace any antibiotics with alternatives, then it is possible to produce birds with little to no antibiotics at no increased cost. However, the other side, which links to the bird's performance, suggests that removing antibiotics from production results in a slower growth rate, so you should expect it to take 1 or 2 days longer for the birds to reach their target weight. There is also an ongoing debate about the importance of a reduced stocking density, and both of these things would negatively impact on the cost of production. One of the most important things to consider is the effect on bird welfare. When removing or reducing antibiotic usage, it should never be done at the expense of bird welfare. And this is where the impact of the different drivers for change come in. When market is the main driver, there is a significant risk on bird welfare. If birds are being produced for a premium price that requires them to have never received antibiotics, if those birds become sick, then there is usually a desire to hold off treating those birds in order to preserve their premium price. And ultimately, this means that bird welfare is jeopardised. When legislation is the driver, there can initially be an impact on cost, as farmers have to invest in new techniques and systems to enable them to adapt to the change. The other potential issue is that if legislation is strictly enforced and very heavily monitored, then antibiotic usage might be driven underground. So to go back to my title, the original question, is no antibiotics ever an option for the UK broiler industry? I genuinely believe that the honest answer to this question is yes. It is an option for the UK broiler industry. It is possible to produce poultry commercially without the administration of any antibiotics. However, I believe we also need to consider the question, should it be the only option? And I believe that the answer to this question is no. We've already discussed the risks to bird welfare that come about when antibiotics are removed from production, and we need antibiotics to be able to prevent the spread of disease. Therefore, I believe that we should not have a no antibiotics ever situation in the UK. So what does all this mean going forwards? The first is that if legislative changes are going to be made, then we need to try and ensure that they are brought in slowly. This means that producers have time to adapt, to look at their production programmes, and put in place systems to try to reduce their requirement for antibiotics. Time is essential to enable growers to look at the options available and assess which ones will and won't work for their farm. And this leads me to my next point. What works on one farm may not have the same effect on another. Each farm needs to be approached individually to assess how they can achieve the required reduction. A blanket protocol across a number of farms is unlikely to achieve the desired results. And my final point is that whatever changes are made, they should always be done with the bird's welfare in mind. Bird welfare is paramount, and a reduction in antibiotics should not be achieved at their expense. Thank you very much for your time and consideration during my presentation.